fact that you're watching this video tells me that you have either made the decision or you're wrestling with the idea of seeing medicine not as a career, but as a calling to serve Christ and to participate with what God is doing in caring for the poor. That's exciting to me. Listen, you're not the first to do this. You're not alone. In fact, I want to just talk a little bit about this movement. Christians serving Christ through medicine and healthcare is nothing new. I mean, take a look at the ministry of Jesus. Jesus did many, many miracles, but the vast majority of the miracles that he did had to do with healing, restoring life. And he told his disciples, he said, the works that I do, you're going to do, and even greater than these. And if you take a look through the early church, through the book of Acts and then on into church history, healing and caring for the sick was always a significant role that the church stepped into. In fact, a lot of people really attribute the first hospitals to the Christians who were practicing the discipline of hospitality. A great read is to look at this guy named Basil the Great in the 4th century. He was a bishop in Cappadocia who started what a lot of people point to as the first official hospital, based around hospitality as being part of our mandate as ambassadors of Christ's kingdom. But something changed about 4 decades ago. A group of Christian health professionals, mostly doctors, some public health and some nursing professionals, they began to ask the question, is there a difference between being a Christian in medicine and practicing Christian medicine? Do you understand the nuance of that question? You know, if Jesus had been born 2,000 years later, and instead of being a carpenter, if he'd have been a physician's assistant or a nurse practitioner, or if he'd been an internal medicine doctor, would he practice the way that we were trained to practice medicine throughout his ministry? And we should be that as well. And so integrated behavioral health is important, but so is integrated spiritual health, and addressing social issues in a person's life is just as important as addressing some of the physiological issues in their life as well. And so treating people in that way, restoring dignity. Jesus treated the woman caught in adultery with the same dignity that he would treat someone who was a learned teacher of the law and a respected member of society. Jesus saw that in each of them, that they were image bearers of God. And so there was value in them. He cared for all people the same way. He didn't discriminate the way that he related to people or the way that he cared for them on the basis of how much money they had or whether they were powerful or powerless or any of those things. And so in the same way, there's a sense of equity and justice that belongs in the institution and industry of healthcare that frankly is missing here in the United States and in most countries, to be honest. And so there were 4 or 5 different groups around the country that all within about a 24-month span, unbeknownst to each other, started clinics that were intended to demonstrate the gospel of the kingdom, to live out the gospel through healthcare among those who are poor and marginalized. They began to tell their stories. A few of them wrote some little books and pamphlets, and articles were made about them, and people began to hear, and other people began to model and visit them and learn from them and improve on their model. And so even CCHF, the way that we were born, was there was a sort of second generation clinic in a little town in South Mississippi called New Hebron, Mississippi. And the way that started was that there was an African American preacher and civil rights leader named John Perkins. John is still alive as to this day. He's 90 years old now. But John had come back to New Hebron, Mississippi, where he had been raised after he'd come to Christ. He moved back there, and a white pharmacist and a black pastor came to him and said, John, there's not a doctor that's willing to see a black person within a 60-minute drive of New Hebron, Mississippi. Can you help start a clinic? And John, who knew nothing about healthcare, but doesn't know how to say no, said he'd be glad to help. And so he did what he does. He preached, and he convinced a couple of white guys from Northern California. One was a family medicine doc just coming out of residency, and the other had been an intern and had some administrative skills. And he convinced them to move to New Hebron, and they started a clinic in New Hebron, Mississippi. And they began to see patients based on the life and ministry of Christ and good medical practice. And about 3 or 4 months into it, they showed up at John's house one night, and they said, John, we're just not sure that what we're doing is the right thing. Medical school did not prepare us for the kind of brokenness that we're seeing. The comorbidities are crazy, and we're having huge barriers. We can't get specialty referrals, and we can't get prescriptions filled. And we're two white guys from Northern California in an African American little rural town in South Mississippi, and we might be offending everybody that we see. We just don't know. We might be doing it all right, but we don't know whether we are or not. What do you think we should do? And so they put their heads together, and they came up with basically an idea to start an organization, and CCHF became that place where people that were doing this type of work could find one another and gather together and share their experiences, and it became a platform for them to share their stories and encourage other Christians to get involved with caring for the poor. And that's how CCHF got started. A lot of the people that do domestic medical missions on a daily basis now, many of those will end up going overseas, and the ones that do will tell you that they were better prepared, having served in cross-cultural, high-needs area where resources are low. It prepared them for the mission field overseas. And a lot of those who've been overseas for some time will end up coming back and doing work here. And I'm going to tell you why I think that that's significant. It's because God has one great global mission. And global in God's mind is not just overseas. The last time I looked, the United States is on the globe, and we are part of God's global mission. There's a doctor in Nashville named David Gregory, and Dr. Gregory, he was a Vanderbilt doctor. He worked at a local hospital in Nashville, and he used to drive to work every day through the middle of a neighborhood that we would politely call under-resourced. A lot of housing projects, a lot of poverty. And when he would get to the hospital, he was alarmed to see how many people there were there who were coming in really, really sick, had needed a doctor a long time before they got to the hospital, and who didn't have any insurance. They had huge barriers to access care. Well, it took about 3 years for them to work through all of the details, but they opened a clinic and called it Siloam Family Medicine. And they opened a clinic in a low-income apartment complex. They had a little bitty apartment. Their waiting room was a bunch of plastic chairs sort of on the porch outside. And almost immediately they were overwhelmed. And so they grew. They grew there in the apartment area. And then a few years later, we're able to afford to build a dedicated building not far from that apartment complex, just down the road a bit on 12th Avenue or 12th Street, I forget which. But it's a beautiful facility. It rivals any doctor's clinic or doctor's office in the city in terms of just beauty and quality and that kind of thing. But now has 2 sites. They're a leader in community health and upstream approaches to healthcare, as well as primary care. They have, for many years, have had integrated behavioral health, integrated spiritual health. They pray with virtually all of their patients. They do it in a way that's faithful to the gospel and faithful to whom they are, but respectful to the people that they're ministering to. And Siloam now is a training center that is training doctors and nurse practitioners and PAs from a couple of the different colleges there in the Nashville area, and helping people learn how to care for people in Jesus' name and in the way that Jesus did that. I've got scores of stories like that. It's a wonderful community that you are now part of. We're excited about that. We're excited that you're going to be that part of that generation that moves this movement even further. And so we're praying for you. We've prayed for you to get to this point. We're praying for you as you face the challenges that are ahead.